The ankle wall test is a great test to now take from your overhead squat assessment and overlap to see just how immobile or how many issues we have in the ankle. Now, the ankle mobility test or the ankle wall test is going to look at two factors, whether or not there's a joint issue or just a muscle issue. So Sarah's going to come over here and we're going to show you how to actually perform this test. Now, this test will be determined based on your height. Now, I've actually gone out and made these. They're very simple. They're called door stoppers. They're plastic from Home Depot. And I've pre-cut these to 4.5 inches, 5 inches, and 5.5 inches, which makes this test so much easier. These cost like $6 to make. I'd highly recommend you make them as opposed to constantly using a measuring tape to do the test. Now, depending on the person's height will determine how far away their foot is. Between anything under 5'6" will be 4.5 inches away. 5'6" to 6 feet will be 5 inches away, and anything over 6 feet will be 5.5 inches away. Now, Sarah, you said you're under 5'6", so we'll be using the smallest one here, the 4.5 inch marker. Now, we're also going to be determining if there is a muscular issue, whether or not it's going to be a gastroc or soleus. So this test is done in two different ways, kneeling and standing. The kneeling version of this test will primarily look at any soleus tightness or issues. The standing version will look at any gastroc issues. And if at any time the client is complaining or giving you a signal there's a lot of pressure in the front of the foot, that will signal more of a joint issue. So let's go through this test. So Sarah, if you don't mind, we'll be in a lunge position. We're going to take our little measuring device here and place that against a wall or any kind of marker that we're going to use. Sarah's going to place her toe right on the edge of that marker and then drop down into a lunge position. This position here is going to be looking at the mobility of that ankle. The two restrictions that we may have in a kneeling position is going to be from the soleus, now that we're in a kneeling position, or the actual joint itself. So to pass this test, Sarah has to be able to touch her knee to the wall without her heel rising at all. So let's cover that part first. So if you can, so as the tester, I'm gonna place my hand right under the heel and I'm gonna make note as soon as that heel starts to rise up. So go ahead, and we already have a rise. So come back again, go do that slowly, already have a rise. So that heel should stay down the entire time. That knee, just do me a favor and push that knee all the way forward. See what happens to your heels here? They completely rise. Now, remember when we did that overhead squat assessment, her posture, that forward lean, we assumed that that was coming from the ankle. We lifted up her heels, solved the problem. Now we're isolating that, doing this test, so we can also see that ankle mobility is a restriction. Now, one thing I want you to focus on right now is, if you push that knee forward, where do you feel the restriction, from the back of the leg or in the front?
Back.
Okay, so if the person is saying that, you know what, I feel that restriction from the back of the leg, then we proceed into that, all the joint distraction. We'll get into the fascial release for that soleus to help break this up to allow for more mobility. Now we'll also do the same thing standing. So do me a favor, leave your toe there. The second part of this test we're going to test is the standing version, which is also going to look at the gastroc as opposed to the soleus. Now, I'm going to get you, again, so finger under the heel, slowly push the knee forward, and already that heel starts to come out. I'll go all the way, go all the way, go all the way. That heel is going to rise. Now, one thing that's interesting that we'll note is, go ahead and do that slowly again. Notice the angle of her femur now and the tib, how that is coming forward. We talked earlier when we look at that knee buckling, and that knee buckling and that knee coming in, that femur rotating, and we said, make sure to check the ankle first. In this situation, because her tib and fib don't want to move over that talus properly, she's actually turning that knee to try to create more space without having to move that shin further forward. So again, when we have that issue with the knee buckling, always make sure to check the ankle. In this situation, now keep that ankle down and push forward again. Do you feel any tendon or tightness through here or just in the back?
A little in the front, mostly in the back.
Okay, so we have a little bit of tendon or tightness through here, indicating that there's also a joint restriction issue and some tightness through here and here. So both the gastroc and the soleus need to be released, and we also have to do some release for the actual joint of the ankle.